RADICAVA ORS, edaravone, is a treatment for amyotrophic lateral sclerosis, or ALS. Why RADICAVA ORS for ALS? Starting treatment now may help slow the loss of physical function for as long as possible. Individual results may vary. Please see important safety information at the end of this video. There's no cure for ALS yet, but as of 2025, there are 2 treatments available for non-familial or sporadic ALS. These are edaravone, which is the active ingredient in RADICAVA ORS, and riluzole. These treatments are often used together in clinical practice. In the RADICAVA clinical study, approximately 90% of patients were also receiving riluzole. Ask your doctor about the best treatment plan for you. To see how RADICAVA ORS may help, let's first look at how your doctor uses a tool called the ALS Functional Rating Scale Revised, or the ALS FRS-R. You may not even be aware of this functional rating scale, but in addition to doctors using it to monitor disease progression, it's also often used in ALS clinical studies and by insurance companies to assess coverage eligibility. The ALS FRS-R looks at 12 daily activities in 4 groups. Bulbar, like swallowing. Fine motor, like dressing or hygiene. Gross motor, like walking. And respiratory, like breathing. Each activity is scored from 0, meaning can't do, to 4, meaning can do with ease. These scores add up to a total of 48 points. Higher scores indicate better functional ability and less impairment. ALS affects everyone differently, but on average, patients lose about 1 point each month. That can make a big difference in what your body can do, so every point matters. For example, losing 1 point in the fine motor category could mean losing the ability to cut food. So, how can RADICAVA ORS help? RADICAVA ORS is an oral form of RADICAVA, edaravone, which was studied and proven to help slow the loss of physical function. In the clinical study, RADICAVA slowed the loss of physical function as measured by the ALS FRS-R. Patients taking RADICAVA lost 2.49 or 33% fewer points on average than those taking placebo, based on the ALS FRS-R. So the decline in functional ability for patients who received RADICAVA was 33% less than for those who received placebo. Remember, even a small change in your score could make a big difference in your functional ability, like being able to eat on your own, to needing someone to help you. In our study, over 90% of the study participants were also being treated with riluzole. Your doctor may recommend taking RADICAVA ORS in addition to riluzole. Starting RADICAVA ORS now can help slow the loss of physical function for as long as possible. RADICAVA ORS was generally well tolerated. The safety profiles of RADICAVA and RADICAVA ORS were established in over 500 patients with ALS in multiple clinical studies. Common side effects reported include bruising, problems walking, headache, and fatigue. These are not all the possible side effects of RADICAVA ORS. Fewer than 6% of patients, that's 11 of 185, discontinued RADICAVA ORS in the 6-month study because of side effects. Approximately 1% of patients, that's 2 of 185, discontinued RADICAVA ORS due to gastrointestinal side effects like diarrhea and trouble swallowing. Other reasons for discontinuation in about 1% of patients, that's 2 out of 185, included respiratory failure and muscular weakness. Be sure to tell your doctor if you are allergic to other medications and share with them all of the medications you are taking. The ALS journey can be hard to navigate, but what you can do next relies on what you do now. So ask your doctor if RADICAVA ORS is right for you. Please continue watching to hear important safety information. Indication: RADICAVA ORS edaravone is indicated for the treatment of amyotrophic lateral sclerosis, or ALS. Important safety information: do not receive RADICAVA ORS edaravone if you are allergic to edaravone or any of the ingredients in RADICAVA ORS. Before you take RADICAVA ORS, tell your healthcare provider about all of your medical conditions, including if you have asthma, are allergic to other medicines, are pregnant or plan to become pregnant. It is not known if RADICAVA ORS will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if RADICAVA ORS passes into your breast milk. You and your healthcare provider should decide if you will receive RADICAVA ORS or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of RADICAVA ORS? RADICAVA ORS may cause serious side effects, including hypersensitivity or allergic reactions, and sulfite allergic reactions. Hypersensitivity reactions have happened in people taking RADICAVA ORS and can happen after your medicine has been taken. RADICAVA ORS contains sodium bisulfite, a sulfite that may cause a type of allergic reaction that can be serious and life-threatening. Sodium bisulfite can also cause less severe asthma episodes in certain people. Sulfite sensitivity can happen more often in people who have asthma than in people who do not have asthma. Tell your healthcare provider right away or go to the nearest emergency room if you have any of the following symptoms: hives, swelling of the lips, tongue, or face, fainting, breathing problems, wheezing, trouble swallowing, dizziness, itching, or an asthma attack in people with asthma. Your healthcare provider will monitor you during treatment to watch for signs and symptoms of all the serious side effects and allergic reactions. Common side effects reported include bruising or contusion, problems walking or gait disturbance, headache, and fatigue. These are not all the possible side effects of RADICAVA ORS. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to www.fda.gov/medwatch or Tanabe Pharma America Inc. at 1-888-292-0058. Please see the full prescribing information and patient information available at www.radicavaors.com.